For all her life, 6-year-old Alice Mohoni lived with her grandparents, her legal guardians. But in May 2020, her grandfather died from COVID-19, leaving only her grandmother to raise her. Now, her grandmother, her remaining caregiver, is struggling not only with the psychological toll of becoming a widow, but also with the practical difficulties of raising a child with less support.
We had a good family structure, but with the passing of my husband, it collapsed. I'm now earning just a fraction of the retirement pension he received when was alive. Thank God we are not facing hunger, but everything is much tighter now.
A report published this month in The Lancet estimates that more than 860,000 children have lost at least one parent or primary caregiver to COVID-19. Brazil is among the worst affected countries, with more than 130,000 children in such situation, second only to Mexico, with 141,000. In the state of São Paulo, the government has created a program to assist these families with a grant of about $350, split in 6 monthly payments.
Especially in families in need, normally they have one person that was responsible for the whole budget of the family. So this makes a big impact, and we see families completely destructured by these cases.
Money helps, but that's not all that's needed to assist the orphans of COVID-19. The authors of the study on children orphaned by the pandemic say different measures and strategies are needed to minimize the impact of such trauma on kids and their extended families.
What we found is we can learn lessons from what has worked in previous epidemics and apply those lessons now. We know a 3-pronged approach: prevent, prepare, and protect will be effective in protecting children, helping them recover and gain resilience to face life moving forward.
It's hoped that vaccinations will help control the COVID-19 pandemic, but the impacts on families during this health emergency will have to be dealt with for years to come. Paulo Cabral, CGTN, São Paulo.